A plan to transport homeless patients from a Baltimore hospital to a proposed treatment facility in Westminster is drawing opposition from local leaders there. As WMAR 2 News' Jeff Hager reports tonight, they say exporting the disenfranchised to their downtown area is just fraught with potential problems.
Almost a century after serving as a distillery for rye whiskey, this building in downtown Westminster now serves the downtrodden, and Access Carroll Integrated Healthcare receives a lot of the credit.
Access Carroll, which has been operating in Westminster for several decades, does a great job at helping Carroll County residents.
But Access Carroll's bid to create a program to house homeless patients for continuing treatment after being released from a hospital in Baltimore has now backfired.
The clients that would travel to Westminster are coming from Sinai Hospital. They're not Carroll County residents. They're not Westminster residents, and they would be placed in a voluntary program that they could leave at any time.
Access Carroll would expand its footprint here inside the old Distillery building by nearly 8,000 square feet, adding an 18-bed unit which would provide medical treatment for the disenfranchised. Some local merchants fear an influx of people with behavioral, mental, or addiction problems could be bad for business.
Crime is not a major problem here in Westminster. It's continually gone down for probably the past 15 years or more. We don't need to bring this in and turn that trend around.
Carroll County State's Attorney Haven Shoemaker also is opposed to what he deems to be importing the homeless. And he says county commissioners rushed to sign a lease with the healthcare provider at the first sign of opposition to the project.
In this particular case, I think Access Carroll's wrong. I don't blame them. They had a $7 million carrot dangled in front of them by LifeBridge, who made a shrewd business decision because, they're paying like $6,000 a day per patient to care for these folks at Sinai or whatever.
Access Carroll did not respond to our request for comment, but we're told the estimated cost to house each patient would be just $248 per day here at the distillery, notwithstanding any impact it may have on the area surrounding it. In Westminster, Jeff Hager, WMAR 2 News.